Hi, my name is Sonia Mosley, and I'm a registered nurse with the Kentucky Immunization Program. I've been a public health nurse for 18 years now, and the first 10 years I was in the clinic as a clinic nurse providing services, and the last 8 years I've been working for the Kentucky Immunization Program as a field representative, and I am located up in the northern Kentucky area. And this is a program titled Immunizations 101 in Public Health Nursing, and it's a program that I've actually been offering up in northern Kentucky for the past couple of years to all the new nurses that start, and we felt that it would be a great program to offer to the state. There were some handouts available to you that you should have printed out ahead of time on the registration page, and one of those handouts was titled Website Resources. And I just want to bring your attention to the first link on the website resources, and that is the Kentucky Public Health Practice Reference. This is a reference that you need to get very familiar with because as a nurse, you will be practicing under signed protocols. So these are your standing orders, and there is an immunization section in this practice reference. The reference is available online, and it's also available in your clinic either on as a hard copy or on CD. And we will now go ahead and get started with the program. Okay, the first thing that we're going to cover is I just want to review some of the objectives that we're going to be discussing. We're going to be talking about the different types of immunity, the different classifications of vaccines, the difference between contraindications and precautions. We're going to discuss VAERS and how to report into that system, the different routes used for vaccine administration, the different documentation requirements that you'll have, the importance of appropriate vaccine storage and handling. We're going to distinguish between recommended versus required vaccines, and then we're going to talk about some valid science-based immunization resources that I want you to have available to you. But before we get started, I just want to give you a little bit of an idea about what it was like before we had vaccines. There were thousands of people's lives that were affected every year from vaccine-preventable diseases. Many people were crippled by polio, or they had to live in the iron lungs, as you see here on the screen. I think a lot of people don't realize how important vaccines are because we don't see these diseases as much as we used to. And there's actually some who think that we don't even need vaccines anymore. But it's very important for us to realize that it hasn't been that long ago since we've had diseases in the United States. Just up recently in northern Kentucky, we had a child die of Hib disease. And it was, the child had not been vaccinated, and so these diseases are still around. Back in the 40s, we were having problems with pertussis, and as many of you know, that is also a disease that we've been having a hard time with recently. Just in this past year, in 2010, we had outbreaks of pertussis, and they have created a vaccine now to where teenagers and adults need to get that vaccine so that we can get this disease under control. But since vaccines have been introduced, the disease rates have greatly declined, especially here in the United States, because we do vaccinate so well. This is a poster that I just think is real interesting. I found it on the internet. It was back in the early 50s. It was how they were telling everyone to avoid polio. This was before a vaccine was created. And basically they were telling people to not mix with new groups, not to get overtired, don't get chilled, but do keep clean. Well, we know that getting plenty of rest and staying warm is not what protects us from polio, but that our protection comes from immunizations and our immune system. So that's what we're going to talk about now, is immunity. And there's basically two different types of immunity, and vaccines work by using our immune systems. There's passive immunity, and that's immunity that is passed on to us or transferred to us. It's only temporary. An example would be receiving immune globulin, or it's also the maternal antibodies that are passed on to us at childbirth. Active immunity is immunity that we receive from our own immune system. It is more long-term, and we achieve active immunity from getting the disease itself, such as chickenpox, or from getting the vaccination. There are two classifications of vaccines. Inactivated vaccines are made inactive during production, and they do not replicate. These vaccines cannot cause the disease from the vaccine, so it's okay for us to give that to someone who's immunodeficient. They have mostly local side effects, and a person needs generally 3 to 5 doses in order to produce immunity. And then there's live attenuated vaccines. These vaccines are produced as a weakened form of the wild virus or bacterium. These vaccines must replicate or grow in the body to produce immunity. And due to this ability to replicate, live vaccines should not be given to persons who are immunodeficient. The side effects for live vaccines are very similar to the natural infection itself, such as getting a rash after you would receive measles vaccine, or getting swollen neck glands after you would receive mumps vaccine. Live attenuated vaccines will provide a long-lasting immunity with only 1 to 2 doses. This is a list of the inactivated vaccines that are currently recommended for children, and the majority of the vaccines that we give are inactivated. And this is a list of the live attenuated vaccines. The ones on the left-hand side are the ones that you will be giving in the health department clinics, and the ones on the right, yellow fever, typhoid, those are travel vaccines. Some of your health departments may still do travel vaccines, but I think the majority of them do not. So these would be given in a travel clinic. Oral polio is not used in the United States anymore, but it is used in other countries. And then I just want to go over the difference between upper and lowercase letters when it pertains to diphtheria, tetanus, and pertussis containing vaccines. So if you'll just notice the top line, it's the DTAP. That's licensed for 6 weeks through 6 years of age, and all of the letters are capitalized: diphtheria, tetanus, acellular, pertussis, because they have more of those particular antigens in the vaccine. The second one is diphtheria, tetanus. It's the same vaccine as the top, except for they have taken the pertussis out of it for children who cannot have that particular type of vaccine. The Tdap, the third one down, has the same amount of tetanus. It has smaller amounts of diphtheria and pertussis, so those are written in lowercase letters. That particular vaccine is recommended and licensed for teenagers and adults as a one-time dose. And then the fourth one is TD. That has the same amount of tetanus but a smaller amount of diphtheria. And the main thing that I want to point out for you is that you can have all of these vaccines in your refrigerator at any given time. So it can be very confusing when you're trying to decide which one you want to give to your patient. So I just always like to remind you to take your time, make sure that you're getting the right type of vaccine out of the refrigerator, and if you need to, have someone double check you until you just get real comfortable with what you're doing. Okay, we also have combination vaccines. These are very nice. They greatly reduce the number of injections a child receives, but they can also cause confusion. And these are all the ones that are available for children right now. Pentacell and Pediarix are what we call pentavalent vaccines, and that means that they have 5 different types of vaccines in the same injection. So Pentacell is your DTP, polio, and Hib all combined in one injection, and that is for 6 weeks through 4 years. And then we have Pediarix, which is DTP, polio, and hepatitis B all combined in the same shot. Kinrix is for your 4 to 6-year-olds, so those would be the kids that are coming in getting ready for kindergarten, and that contains DTP and polio. Comvax is hepatitis B and Hib, and then your Proquad is your MMR, which is measles, mumps, and rubella, and your varicella combined in the same shot. Again, I like to remind you that you want to slow down when you're getting things out of the refrigerator. Make sure that you know exactly what it is that you need, and go to someone else to double check you until you're very comfortable giving immunizations. Okay, now we're just going to go ahead and start talking about administering vaccines. This is one of the handouts that you should have printed off prior to this presentation. And it's basically a lot of really good information on one piece of paper. When administering vaccines, we need to make sure that we have the correct dose of vaccine, that we use the correct route, that we choose the correct needle size, and that we choose the right site. And this handout has all of that information on it. So when you're learning to administer vaccines, you want to keep this resource handy. Intramuscular injections. I know that this is a refresher for you nurses who have already gone through school, but just as a nice reminder. We want to make sure that we insert the needle at 90 degrees, and for most children you're going to use a 1-inch needle, 23 or 25 gauge. But when you get into teenagers or adults, if they're a heavier person, you're going to want to move on up to a 1.5-inch needle. And the reason that we say that is you want to do IM injections deep in the muscle because that's going to give the best results. It will also help decrease any of the vaccine getting into the subcutaneous tissue, which can cause their local reaction to be worse. We give IM injections in the deltoid muscle or the anterolateral thigh muscle. These are the vaccines that we give intramuscularly, and it is the majority of the vaccines. You can give 2 vaccines in this. You can give 2 IM injections in the same muscle. You just want to make sure that you are at least 1 inch apart. I do want to bring to your attention the last 2 listed, pneumococcal polysaccharide, which is basically just adult pneumonia vaccine, and then the inactivated polio vaccine. They can be given IM or sub-Q. And then we have subcutaneous injections. These are the ones that we insert at a 45-degree angle, and you can use your 5/8-inch needles on these, and they're just going to be injected in the subcutaneous tissue. And you can use the fatty tissue over the anterolateral thigh, or the fatty tissue in the back of the tricep. And these are the subcutaneous vaccines that we administer. We also have other routes that we give vaccines. There's a flu vaccine called Flu Mist that we give intranasally. And then we also have oral vaccines, and this is how we administer rotavirus vaccine. Okay, now we're going to talk about just intervals between doses. Now remember, when the inactivated vaccines, when we're giving those, we're giving multiple doses of those for protection to take place. And the live vaccines, we're giving 1 or 2 doses for that protection to take place. And it's very important that we give these doses at the appropriate intervals. So I want to refer you to another handout that you should have printed out ahead of time, and it's called Minimum Ages and Intervals Table. This table tells us the recommended age for a vaccine to be given, and then the minimum age that the vaccine can be given. So for example, if you'll look at DTaP dose number 1, it's recommended to be given at 2 months of age, but it can be given at the minimum age of 6 weeks and still be considered a valid dose. The table also tells us the recommended interval between doses and the minimum interval between doses. So for example, it's recommended you wait an interval of 2 months between DTaP number 1 and dose number 2, but you can give dose number 2 at a 4-week minimum from dose number 1 and it still be considered a valid dose. Decreasing the interval between doses is not good practice. It's definitely not something that you want to do because those doses will be considered invalid and will need to be repeated. So if a patient shows up early for their shots and the minimum interval has not been met, you do not want to go ahead and administer that vaccine. Increasing the interval between doses, however, is not going to diminish the effectiveness of the vaccine. And many times we don't have any control over this because we'll ask the patient to return in 2 months for their next set of shots, and they might not return for 6 months. So we're going to just continue the series where we left off. You don't ever want to restart an immunization series over again. In Kentucky, we recognize a 4-day grace period, and that's something that is recognized across the entire United States. But what that means is if a person comes in within 4 days of when a minimum interval has been met, you can go ahead and administer that vaccine. And here's an example of that. The last dose of DTP, which would be the 5th dose, and the 4th dose of polio, if you look on your table, it tells you not that the minimum age for that is 4 years of age. So if a child comes into the clinic 2 days before they turn 4 and they're scheduled a well child exam and their immunizations, you can go ahead and administer those vaccines based on that 4-day grace period. If they come in 5 days early, you are not going to give those vaccines. So it does make a difference that you do not go outside of that 4-day grace. Okay, this next table that we're looking at is going to help us to determine the timing and spacing between inactivated and live vaccines. All vaccines can be given simultaneously or at the same time on the same day, whether they are inactivated or live vaccines. It is an immunization best practice to give all vaccines that a child is due to have on the same day. You do not want to defer a vaccination because you want to limit the number of sticks that a child will get. If for some reason you are not able to give all the vaccines indicated, for example, maybe the parent is limiting you on the number of vaccines that they want you to give their child that day, then you can use this table to figure out the spacing intervals between inactivated and live vaccines. So inactivated and live vaccines you can give on the same day, or you can give them any time before or after. So an example of that would be an inactivated vaccine would be DTP. If you could give that today, and you could bring them back in tomorrow and give an MMR, which is a live vaccine. It's the same case with inactivated vaccines. If you're going to be giving a DTP today, you could bring the child in at any time before or after and give a polio vaccine, which is another inactivated vaccine. But when we have 2 live vaccines that need to be given, so for example an MMR and a varicella, you have to give those on the same day, or we have to separate them by 4 weeks. So if a child were given MMR today and for some reason the chickenpox vaccine was not given, you have to wait the full 4 weeks before you give that varicella. And this is the only time that the 4-day grace period does not apply. So if you tell them to come back in 28 days, which is 4 weeks, and they end up coming in 26 days later, you are not going to give that second live vaccine because it will be invalid and will have to be repeated. Okay, contraindications and precautions. A contraindication is when a person comes in who you're wanting to immunize and they have a condition that greatly increases the chance of them having a serious adverse reaction or side effect. A precaution is a condition in the recipient that might increase the chance of them having a serious adverse reaction or side effect. An example of a contraindication would be someone who has an allergy to a vaccine component, or they had an allergic reaction to a previous dose of vaccine that they received. So in that situation, it would be contraindicated that you would give them another dose of that vaccine. A precaution is where an example would be where they would come in and would be moderately or severely ill that day, and you would make the decision that you're going to hold off on vaccines until they're well. And you have a handout that's titled Guide to Contraindications and Precautions to Commonly Used Vaccines, and this handout will help you determine what are true contraindications and precautions. This slide also shows you screening questionnaires, and one of your handouts is the screening questionnaire, and it basically just goes through different questions that you should be asking the parent or the guardian to determine whether or not there's a contraindication or a precaution present. This particular screening tool is not used in our health departments. We do have a form that is used where these questions are asked, but I like this form, and I like for you to have access to it, because on the flip side it tells you exactly why you're asking these questions and gives you a rationale for each question. Okay, adverse reactions. Basically, these are just another name for side effects. And there are 3 general categories of adverse reactions. We have local side effects, and most of your inactivated vaccines are going to have local reactions, and that can just be pain, swelling, or redness at the site of injection, and that's pretty common. We also have what's called systemic side effects, and these are side effects that can affect your entire body. So fever, malaise, things like that, and they're not as common, but you will see these more often with your live vaccines. And we also have allergic reactions, and these are due to vaccine or vaccine component, and they're very rare. An adverse event is any medical event that occurs following vaccination that needs further investigation to determine if it was caused by a vaccine. It can be a true adverse reaction, or it can just be something that was coincidental following an immunization. In order to determine if an adverse event needs to have further investigation, we have a system set up in the United States called VAERS. And VAERS stands for Vaccine Adverse Events Reporting System. It's operated by the Food and Drug Administration and the Center for Disease Control. And as medical providers, you are actually required to report into the system any event in the vaccine injury table. And on the website resources handout, there is a link to go to the VAERS site, and you can get the vaccine injury table off of that site. But I also want to point out that anyone can report into this system. A parent can report into this system. And you can actually go onto the website and see all the different things that have been reported into the system. And I like to point out to you again that anyone can report into this system, so you can't just necessarily believe everything that's reported into it, because, like I said, parents or anyone can report. Vaccine information statements are the statements that you're going to use to educate your parent or guardian on each vaccine. These statements are required by law that you give a parent a copy for them to be able to take home. You must offer it to them in the language that they read. And please don't always assume that if someone is communicating with you, if they're from another country and they're communicating with you fairly well in English, don't assume that they can read English, so please give them the vaccine information statement in their own language. These are available in different languages on the immunize.org website that you have on your resource handout, website handout. And this will also be part of your documentation. If you note the circled date down in the bottom right-hand corner, each VIS has a date on it, and you're required by federal law to make sure that you're giving the VIS that's the most recent version. These are the 8 different things that you are required by federal law to make sure that you're documenting. And the health departments use a very nice, we call them the MasterCard. Most of the time they're yellow. But they're very nice, and as long as you document in each column, it will help you make sure that you meet all of these requirements. But basically you're going to put the type of vaccine. So you're going to put, did you give, a 2-month-old a DTaP, or did you give them a Tdap? So you need to indicate on the MasterCard which one you gave. You're going to put the date that the vaccine was given, the vaccine manufacturer and the lot number, the date that the vaccine information statement was given, which is going to be the same day as the date the vaccine was given, the vaccine information statement publication date, the address of the clinic where the vaccine's given, and the signature of the person administering the vaccine. If you give a combination vaccine, make sure that you're documenting all of this information in each portion of that combination. So you're going to document this under the DTP section, document the same information under the polio section, and document the same information under the Hib section for a pentacell combination vaccine. Okay, storage and handling is one of the most important things that I hope you get out of this presentation. And maintaining the vaccine cold chain, which is basically when the vaccine is manufactured, it gets shipped to a vaccine distributor where all of the vaccine is housed. Once an order is placed, the vaccine leaves the distributor and it's shipped to the provider's office or to the health department clinic. And then by the time it comes and actually is administered into the patient, that's what we call the vaccine cold chain. And we need to protect the vaccine during that entire process. We don't want our vaccines getting out of temperature range, so we don't want them to be in excessive heat or cold, because what that does is it damages the vaccine, and we will end up losing vaccine potency and having to waste the vaccine. And please pay attention when your vaccine shipments come. You will get an invoice in the shipping container. and it will tell you how much that vaccine cost, which is always great for people to know because it makes you more aware of how important the storage and handling is. Many providers will have thousands of dollars of vaccines in their refrigerator or freezers at any given time. So please make sure that this is something that you do. This is just letting you know what the temperatures have to be for the vaccines to remain safe. And it shows you where the vaccines need to be kept, in the refrigerator or the freezer. So the freezer needs to be kept at 5 degrees Fahrenheit or colder, or if you're using Celsius, that would be negative 15 degrees or colder. And Fahrenheit is 35 to 46 degrees for the refrigerator, or 2 to 8 degrees Celsius. We keep all varicella containing vaccines in the freezer, and we also keep measles, mumps, and rubella in the freezer. All the rest of the vaccines are kept in the refrigerator at the 35 to 46 degrees Fahrenheit. And there are certain vaccines that you do not want to expose to light. Your varicella containing vaccines and MMR you want to protect from light. Your HPV, meningococcal, rotavirus vaccines, all of those need to be protected from light. And basically what I mean by that is you don't want to dump the vaccines out of the original boxes into any other type of a container. Keep them in the boxes and keep the lid closed when you're in between getting doses out. You don't want to pull a dose out of the refrigerator and leave it sitting on the counter while you're doing your well child exam. So always prepare your vaccines right before you're going to give them, and this will be a way that you can protect them from light and also keep them from getting too warm. One of the links that I gave you on your website resources handout is the CDC's Storage and Handling Toolkit, and that's a great resource. There's a video on there called How to Protect Your Vaccine Supply, and I highly encourage that you watch that. We always monitor the temperatures of the vaccines twice a day, and you will be monitoring these and recording them on a temperature log, and someone in your clinic should have responsibility of doing this. So you want to take your temperatures when you get into the clinic first thing in the morning, and then check them again towards the end of the day before everyone goes home. This is a picture of the temperature logs that are used, and it just again reminds you that in the white area for the refrigerator you want to stay between 35 and 46 degrees. This is for a clinic that would be doing Fahrenheit readings. And it tells you that you should aim for 40 degrees right in the center, because you want to have leeway for it to go colder and leeway for it to go warmer without it going out of range. And if you notice, if you check in the red area, it tells you to take immediate action. And this is just where you're going to report to your supervisor, who is trained on what type of actions to take. The freezer section is at the bottom. Again, 5 degrees Fahrenheit or colder is okay. We just don't want it to go above 5 degrees. So you'll notice that 6 degrees and higher, you're in the red shaded area, and you would need to take immediate action. Okay, the Vaccines for Children program, I just want to review this because this is the majority of the immunizations that we give in the health department. This program started back in 1994. It's a federally funded vaccines program that's specifically for children who are eligible. And the reason that they came up with this program is to help eliminate or reduce vaccine cost, and also so that there are not any barriers to vaccination. We want everybody to be able to receive their vaccines. The VFC program is available in all health departments, but it's also available in private provider offices if they choose to be a part of the program. And it covers all vaccines that are recommended by the Advisory Committee on Immunization Practices. This committee is referred to as the ACIP, and it's basically our vaccine experts across the country who come up with our immunization recommendations. And I want to go over VFC eligibility because it's very important that you know what this is and that you only administer VFC vaccine to children who are eligible. So the first requirement is that the person be 18 years or younger. So anyone who's 19 years of age will not be receiving VFC vaccine. But they also have to meet another criteria. They have to either have a medical card or a K-chip card. They can be uninsured, which just means they have no insurance at all. They can be American Indian or Alaska Native. And then they can also be eligible if they are underinsured. This is where a child would have health insurance, but their insurance does not cover vaccines. It also would be a situation where their insurance may cover all of the vaccines except for one. You know, for instance, maybe it doesn't cover the HPV vaccine, so that child could come and have HPV vaccine out of the VFC program. Every year, the ACIP puts out immunization recommendations. And these recommendations are, they're just our guide that tells us what children need to have, and it also gives you the age range of when they should have each dose. So this particular schedule is for 0 through 6 years, and the yellow is just the range of recommended ages that they were to receive these particular vaccines, and the purple is for certain high-risk groups. They also have a recommended schedule for 7 through 18 years of age, and this particular schedule includes a catch-up immunization, which is in the turquoise color. They also have one of these for adults. I did not provide this for you, but you can get the immunization recommended schedule for adults off of the CDC website. Now this is the catch-up schedule. This is something that I look at just about every single day. People call me and ask me questions on how to catch a child up who has fallen behind on their immunizations. And this is the table that I use. You'll notice that it is also split up into 2 different age ranges. At the top you've got your 4 months through 6 years, and then at the bottom is your 7 through 18 years of age. And the main thing that I'll point out on this schedule is that the older a child gets, as they fall behind, they won't necessarily get all of the doses that they would have gotten if they had have kept on schedule. So this this grid is going to help you determine how many doses they need and what the intervals are between doses. Okay, we have recommended vaccines, which are all the vaccines that we just went over off of the recommended schedules that are put out by the ACIP. And then we have what's called required vaccines. Required vaccines are what's legally required by each state for their children to be in child care or school settings. And each state has their own immunization regulations. Most of the time they're pretty similar, but there are some differences. In Kentucky, we have an administrative regulation, and I've named it right there for you. But basically it is just the immunization schedules for attending daycare centers, certified family child care homes, and other licensed facilities, all preschool programs, public and private schools, and this goes all the way through high school. Once the kids get out of high school, if they're entering college, we do not have a mandate for what college age students have to have. Each college will have their own requirements for that. So, in order for us to show that a child has received all of their required vaccines for them to either get into daycare or school, we have certificates. And in Kentucky, we have 4 immunization certificates or exemptions. And I just want to point out that you want to make sure that you completely fill these out. Make sure that they have an expiration date, that you have signed or initialed those, and that you also put your clinic address on that certificate. Certificates in Kentucky can be signed by a medical doctor or an osteopathic doctor, an advanced practice registered nurse, a pharmacist, a local health department administrator or nurse. And those are the only people who can sign immunization certificates. So, 4 different types. We have a regular certificate, and basically in the health department, your computers will print off these certificates for you. You also want to make sure that you have paper copies of the certificates for when your computers would go down. You might end up having to handwrite these. But you're going to use a regular certificate for when a child is completely caught up on their immunizations for 1 year or more. A provisional certificate is used when a child has all of the immunizations that they can have, but their next immunizations are due in less than 1 year. We like to use the provisional type because it alerts the child care facility or the school that the child does have something coming up in less than a year. We also have medical exemptions that a physician can issue for children who can't have certain vaccines. An example of that would be maybe a child who has cancer and would be on chemotherapy, and those children would not be able to receive live vaccines. Well, we still want them to be able to, attend school, so they would be issued a medical exemption. And these will have an expiration date so that the child can go back after they're finished with their chemotherapy, and they would be able to possibly receive those live vaccines, and they can be re-evaluated by their medical professional. And then we also have in the state of Kentucky religious exemptions, and these are for parents who do not want their child immunized based on their religious beliefs. These exemptions do not have an expiration date, and they will follow the child as they go through the school system. Okay, this is a resource that I absolutely love. It's called Epidemiology and Prevention of Vaccine Preventable Diseases. This is one of the links on your website resources handout, and people call it the Pink Book. So when they say the Pink Book, this is what they're talking about. It's an excellent resource. The latest edition that's come out is the 12th edition. It is available online, like I said, and I would highly recommend that you put this in your favorites so that you can pull it up whenever you need it. Most health departments will also have a hard copy of this edition, but your online version is always going to be the most up-to-date. Sometimes when they print these hard copy editions, they realize that there's errors in them, but the online version is always correct. So I highly recommend that you find this resource and check it out. Most of the handouts that I've given you today to print out are out of this resource book. Some other things that I want to bring to your attention. The pink book is actually a course manual for a CDC educational tool where you can go online and learn everything you would want to know about immunizations by doing several different modules. I can't remember how many there are now, but it's a great program. There's also a link on your website resources for the CDC immunization update. That is something that's held every year, usually around August, and it's one of my favorite updates. They just talk about changes that are going on with vaccines. They'll hit highlights of things. So that's a very good educational resource. You also have the link to You Call the Shots. This is just another really good web-based training that the CDC has put out. And I've also already mentioned the storage and handling toolkit. So just when you have time, check out those resources. This is a great way to keep yourself updated on new immunization information. On your website resources, there's a Immunization Action Coalition website, and it's right there at the bottom, www.immunize.org. Great website to go to for all kinds of immunization information. But one of my favorite things that they do is they have an email newsletter called IAC Express. And this newsletter is just strictly on immunizations. It comes out about once a week across your email, and it's just a great resource for keeping yourself up to date. Okay, the last thing I want to talk about today is vaccine skepticism. And if you watch TV at all, you guys are aware of the anti-vaccine things that are going on in the news. There's a lot of people that are concerned about the safety of vaccines. And they're going to come into the clinic and they're going to talk with you about it and let you know that, they might not want their children to get vaccinated, or that they're just scared to get their children vaccinated. And what I want to bring to your attention is that nurses are one of the most highly trusted people in society. They do studies all the time to figure out who does the community trust, and nurses are always up on the list. So please keep that in mind. What is coming out of your mouth is trusted information for your patients. But what you've got to keep in mind is that you've got to be knowledgeable about all the different issues that are going on with vaccines right now. There's the autism issue. There's a few years back there was the thimerosal issue. People are concerned about vaccine ingredients. And there's a whole bunch of other issues that are going on. And I just want to stress to you that you need to educate yourself about all the different issues. Make yourself knowledgeable so that when you're counseling your patients, you come across as knowledgeable and confident about what you're saying, because they will be the first people who know that you're not knowledgeable and you're not confident about what you're saying. So please do your homework up front. I have provided a resource on the website resources handout just on vaccine safety. So please check that out. It's also a handout that you can provide for parents. And I highly recommend that you encourage parents to do their own homework. Tell them not to take your word for it. There have been study after study done to show that vaccines are safe, and refer them to those. Explain to them those studies that have been done. So I just can't stress this enough, that you come across as knowledgeable and confident. If you have any questions, comments, please contact the Kentucky Immunization Program. There's the phone number there. And I hope this has been a beneficial program to you. Thanks.